We've asked some folks to think quick based on what they've heard to try and pick out what what they think the top priorities should be for CANUE moving forward. They're going to each have 3 minutes to state their position, and then we'll open up discussion. So for sure, get the chat going. And if they run out of things to talk about, then we'll move into chat questions for sure. Quickly introduce our discussants today. So Mike Brauer is an internationally recognized leader in environmental health with a focus on built environment and human health. He's located at the School of Population and Public Health at UBC and has numerous other appointments and affiliations around the world. Rae Jewett is a PhD candidate at the University of Toronto in the Department of Geography and Planning. So she's, pardon me, they are representing students from across Canada. They're also a co-founder of the GeoHealth Network. Rosella is a PI and scientific director of the Population Health Analytics Lab at the University of Toronto, and also has a number of other affiliations of interest. Scott Weichenthal is an assistant professor in epidemiology, biostatistics, and occupational health at McGill. And Meghan Winters leads the Cities, Health, and Active Transportation Research Lab at Simon Fraser University. So we'll ask you to each go for 3 minutes. I'm going to go in order of introductions. So over to Mike. What do you think are the top things CANUE should be doing? Go.
Thanks. Thanks for having me. So I kind of align what I heard from all the speakers and in the chat and the survey into some themes and just try and elaborate them. So first on the data hub, and I think the need there is actually to think about how to do this sustainably. So I think it's very clear that we need that people love this. And I can't tell you how many times over the years I've been in meetings with students or actually with partners out in society and just say, well, CANUE's done this, CANUE's done this, go look at CANUE. So now there's this expectation there and really trying to do this in a sustainable way that we can keep updating it and to the extent that we now have the baseline data to evaluate interventions or evaluate policies. We'd like this to continue in a longitudinal fashion. So easier said than done. And then just reflecting a little bit on Ezra's talk and sort of new methodology from the data perspective. One of the things that I think we're still struggling with, and it was very comforting to hear that there's nothing big that we're missing. So nobody said, you know, we should be measuring this, we're not measuring this. But there is this kind of idea that at least when I started out with the imagery work, that we could kind of measure the unmeasurable. So what is it that sort of this complexity, this that if we're not going to measure, you know, 1 exposure, 2 exposure, 3 exposures, but what does it all mean together? And actually, can we try and get a handle on that? And some hope that through some of these imagery, deep network kinds of approaches, or just sort of more multidimensional approaches, we might be able to get a handle on just the sort of context, that sense that you know when you're in a location that it's sort of healthy, unhealthy, and which may allow us to also get at some of the really difficult challenges about things like gentrification. And the tension between gentrification and displacement, and all of these more complex challenges. So that's kind of on the data side. I heard a lot about sort of actionable tools, and it's fantastic to see so the healthyplace.city, healthyplan.city. We've had some luck with health authorities coming to us and saying, can you build a tool for us? And we rely on CANUE for that. So I think seeing more actionable tools, so not just tools for researchers, but tools actually for private citizens and for planners and public health officials, again, to evaluate interventions. Then I think the other theme is related to the tools is, as Antonio mentioned, equity. So really as sort of the defining issue of health in cities for the future. And the timing is perfect for that because equity issues have really become or come into the mainstream as they should have decades ago, but they're into the mainstream discussion now. And if we don't deal with equity, and can we have tools that actually align with that? The other thing that I would say, and my final point, which I think was a little bit of a surprise to me, but it's actually great to see, is there's a need, there's a desire for sort of networking, training, linkages. So I would actually, so two things I actually want to propose or just throw out there. One is actually thinking about CANUE as becoming, or something like CANUE, becoming a professional society. And I'm actually the last person to say, let's have another professional society. But I think there is a niche there. There's a need for that. And I'll just give you the example. Maybe 15 years ago, a group of occupational health researchers started the Canadian Association for Research and Work and Health. And it's still going today, and it's incredibly successful. It isn't that expensive to run. They have annual meetings, and it links people together. And I think we actually have a nexus of, what to do with that. There's an engaged community of researchers, but also people working in municipalities, working in planning, so our sort of societal partners, and there's an opportunity there. The final thing, and I'm trying to remember what it was, it's somewhere in my notes. Yeah, I guess thinking about the need, again, to engage people in cities, we started out with CANUE as having sort of topic level working groups. One thing we could also consider is actually having city level working groups where people coalesce in a city. And this could form organically with a little bit of support from CANUE to sort of, facilitate. I think there's an opportunity there to actually make that step from sort of research to practice. So I will stop there, and I probably used more than 3 minutes, so sorry.
Just barely, but you are a CANUE director and a PI, so we'll give you that latitude. Over to you, Rae.
Hi. Yeah, so I think CANUE for me has certainly been a wonderful community, and I see CANUE as a community space. I think it was interesting to see CANUE as a training center a little bit lower, but that might be because you had 13% of your respondents as students. I would wonder if you had more students responding to the survey, if you would see a greater desire for CANUE as a training center. A lot of students, there are some wonderful labs that specialize at this intersection of health and geography. Many, their PIs are here on the screen. But there's a lot of students who are in labs that only specialize in health or only in geography or only in environment. So CANUE provides this community that's at this intersection, which requires a lot of expertise to navigate. It's an expertise in genre writing, in the skill set, in the data. A lot of students don't know what questions to ask. They don't know what's the next research question with where the literature sits at this point in time. So I think the training center opportunity would be really important. There's a lot of variability in education in our Canadian universities right now when it comes to health geography and environmental health training. So that would also be a nice opportunity that CANUE could take the lead on. So I think that would be really great. And, when we do run these GeoHealth Network events, they're very collegial. It's a wonderful networking opportunity. I have students email me all the time that just saying, thank you for the space. So it is really important. And it's important for the future of this field, of your field. If you want to see this field continue, it's important that people feel welcome in it and people feel like there's a future in it for them and see themselves in this field and that they see jobs in this field. So I think having a training center, having a professional designation or professional organization would be a way to do that and a way to show students that there's space for them here. In terms of the future opportunities, I really like what Mark said about thinking about how systems interact instead of, one exposure, one health outcome. And I really liked what Antonio said and what Michael's saying about equity. One way I'm thinking about equity is in how we approach research design and study design overall. And something that I'm doing more is co-led research and community-led research. So this field, when you start learning about environmental health exposures, it's very data and methods expertise driven because it's such a niche skill. So a lot of us as students become really skilled at data or at the methods side of things. And that means that a lot of us don't have the expertise or, quite frankly, the lived experience to know what research questions to ask. Or when it comes to translating the findings and interpreting them into these interventions and policies that, you know, everyone on the call right now is emphasizing, that really takes lived experience and experience in the community to translate those findings. So I think a good approach to understanding equity would be co-led research with the communities that are impacted by the research you're trying to do. And that partnership would happen before you even define your research question. And something that Ezra said that really struck a chord with me is redefining urban. In Canada, especially, we have a lot of northern urban communities. You know, Sudbury, for example, is that a rural community or is that an urban community? You know, my friends in Sudbury think of themselves as northern urban, or Yellowknife or Whitehorse. So a strength of CANUE is these standardized pan-Canadian data sets that make for reproducible research. But I think it'd be great to understand how the context and the regional context of that data across Canada might change. And I think that could also be a path forward to understanding how different communities are impacted by, say, climate change, or these northern urban or coastal communities are particularly vulnerable to climate change, to economic transitions, to they have unique health needs and unique opportunities with different levels of government. So that's a huge implication for interventions and policy opportunities.
And we're getting close to 3.
Okay, I'll stop there.
Why don't we stop there and people can comment on it. Let's move on to Laura. Thanks, Rae.
Hey, thank you, Eleanor. Thanks everyone for the opportunity. First, let me congratulate Jeff and Eleanor and everyone. I will go out on a limb and say CANUE is probably one of the most important data initiatives for population health, at least in the past 2 decades in this country, for lots of reasons. So just congratulate the team. So I'm going to talk about data, not because it's the only thing that I think CANUE should be focused on, but I'm just going to dig a little deep on data because that's what I think a lot about. And in particular, how we enable multi-linked population health data, which is where I think CANUE needs to go. So first point I want to make, and we heard this a little bit, is there's been tremendous gains made by CANUE and by the data linkages, but we still have the vast majority of data are siloed. And until we start linking this data together, we're getting an incomplete picture. And moreover, we have exposures which we have trouble measuring, and then we just have straight up blind spots. So there's aspects that we know influence population health, that we know around the social determinants of health that influence health outcomes, that we're just not integrating in at all. And if data is action-oriented and being used for decision-making, like I think it should be, that means we're making decisions when we actually have blind spots. It's like a pilot driving a plane with one of the, instruments just off. And so I think that means, focusing more on comprehensive data linkages, maybe even enhancing some of those blind spots. So getting involved in data collection or establishing data collection that we know will fill out the picture for what truly drives population health once you integrate it with environmental and other health data. The second is I'd love to see a major disruption in addressing barriers to access. I heard a lot in the survey, and this kind of keeps coming up again and again, that it's still a challenge to actually have the infrastructure that enables multi-link data, ideally remote access so that there aren't any access barriers, which I know CANUE has a lot of, and ideally also in a high performance computing environment to enable some of the advanced analytics and emerging software tools that we're seeing more and more. So that's expensive and hard to get funded. You don't get that funded from project-specific CIHR grants. So it's going to need a lot of thinking about who's going to invest in that infrastructure and really, disrupt the way we think about data access in this country for population health purposes. And then the last thing I think I'd really love to see is a focus on software and tools that enable data architecture and pipelines, which is way before the paper that you see published. It's sort of just maybe a couple lines in the method, but actually where most of us who work with data spend all our time recreating, and many of us, myself included, I wasn't trained in data architecture or the details of software engineering, but I realize now I need those tools quite a bit, and my team does as well. And so how can we unpack that so it's actually, we don't expect everybody to have those expertise, but we can actually make those tools available. And if we do that, we'll get people using the data. I think that there's so much data that's already existing that we're not even using to maybe even the quarter of the potential that's already existing. So let's unblock that. Focus on infrastructure, focus on making data available, putting it into the hands of people that can actually make a difference. So those are my thoughts. I tried to be snappy to save more time for the discussion. So
Perfect. All right, Scott. Over
Hello.
to you.
Can you hear me? Can you hear me? Okay.
Yes.
So part of the downside of having a last name that starts with W is that you have to think of things the first three speakers didn't already say. So most of what I was going to say had been repeated, but there are a couple of things. I wanted to again congratulate the CANUE team. That what you guys have done is amazing, and I agree with what Mike has said. I often hear from students and other researchers of what that they're using the data, and so that's really been quite a resource for Canada. One of the things I guess I wanted to sort of expand on what Laura had said was particularly when it comes to the machine learning side of things with images. A lot of people are doing this around the world, but we're all kind of doing it separately. And so I think if there could be one centralized place where every labeled geolocated image was just available. Because how many geolocated measurements are available just sitting on a computer that we've done over the years? We kind of do the study and then the data set just sort of dies. And if we really want to take advantage of leveraging, whether it's image or audio or whatever, we need it everywhere. And so I think having a centralized location where people could easily share those labeled data sets, that would be, or even trained models, that would be quite a resource. And also, I think someone mentioned data collection as well. So there are some things that, like aeroallergens, for instance, there's basically one company in Canada that does aeroallergen collection. And so I think that there's probably certain sort of climate change factors like that could use a bit more support on the data collection side, so that we weren't limited by a single company. More on sort of pragmatic side, this isn't exciting, but there are still like government data sets that are basically unusable, right? So like if you download the NAPS data for Environment Canada, it's a disaster, right? It's an Excel sheet with all kinds of weird columns, and like just having that in a very usable format, and I'm sure there are other examples that are available from other places as well, would be very, very useful. And going back to what Mark had said on the sort of policy side, something I'd thought about while I was at Health Canada, but just having a database of future infrastructure projects related to the city, right? Because the project is happening now. We can't do anything, right? That was planned 10 years ago. But if we knew going forward what the plans were for sort of infrastructure changes in city, we could probably provide input and implement some of the things that we know already that don't require more research. They just need us to provide input at the time when it can actually be used. So sort of acting as a facilitator might also be helpful. I don't have anything else.
And Megan, all you need to say is I concur.
I concur. And my novel contributions are, I think you have to stay the data hub and you can't do everything. So I maybe have 2 points. I need you to be the bridge in CANUE. So the hard skills, the data, the imagery, the tools, we need that. And I need you to be the bridge between the research community to put that all in one place so that we're not doing each other's work over and over. Then I need you to be the bridge between that to the, and this is a space I sit in, that stuff to some soft skills and translation that are the policymakers, the users, the modeling out those policies in real time so that that data becomes useful and gets into the hands of, in Antonio's words, all of the living rooms, he didn't say that, across Canada. So at the grassroots and in the policy area. So I think you need, after being the data hub, I need you to be in that space that creates what you've started with some of these tools here. The hard skills matter, the soft skills matter a lot as well. And so I don't need CANUE necessarily to be the expertise in that, but to support and foster that. Now, because I said you couldn't be everything, I think, of course, the training of the students and the knowledge translation and all of these activities have been super fruitful when you're funded. Right now, I think you need to partner through that, as you've done with the GeoHealth Network. Let the students own it, let them shape it, let them take it. Through these Healthy Cities training platforms, which I think you should just walk into whoever gets funded and say, here's what we can do already that we've set up that works. And now can you scale it out through your networks? That's a win-win for both of those parties. And then the place I think I haven't heard you say is like, I sit on a lot of interdisciplinary, intersectoral teams that are SSHRC and NSERC, and I don't know if they're using your work and results yet, and they might bring those soft skills and different applications and blind spots in ways you haven't met before. So it's great that CIHR has supported you. And I think that secondary data analysis grants have been excellent, but I don't know if SSHRC is paying attention to this. And so the inroads to me on the SSHRC is really these policy, they'll do all of these live city level policy interventions. And so if you can make tools that they can use and build in that model both health impacts, but other kinds of impacts they're interested in, I think that that's a synergy. Don't do that at the cost of being the data hub or being the bridge. But if there are tri-council funders, I think that would be a good opportunity. I have 20 more things to say about that. Stop.
I'm going to open it now to you folks to comment or reiterate if anyone of you has a comment on any of the other people's points, and then Jeff will be picking out some pithy question or two for us to handle in the next 15 minutes.
Yeah.
Well, I guess just a thought, and this is really the challenge is like, I mean, these are all fantastic ideas, and Megan said you can't do everything, but actually there's very little funding. So anything has to either be something that will attract funding or be something that doesn't require funding. So I would just sort of encourage, and I don't, again, I'll go back to this example of CARWA, this research and work in health. It's not expensive. And one of the strengths of Canada is sort of, is our size, right? So we're big enough that we actually bring things to the table. We're not too big that things become overwhelming and too expensive. And we seem to, for whatever reason, get along relatively well. And CANUE's a shining example of that. So I would just encourage people to think about things that aren't expensive, but that we can just all collectively participate in. And I think those are the things that are actually likely to succeed. It's always nice to think about, let's go off and get a grant and, and leverage something that may happen, but it will certainly happen if actually CANUE just becomes something essential to all of us, all of our lives. We will always think about it in every opportunity that we all seek.
Good. Anyone want to follow up on that?
Maybe I'll just follow up, like one idea that doesn't cost any money, although it requires goodwill and collaboration, is that anyone that uses CANUE data has to put their data pipeline in a GitHub repository that everyone has access to. And that will help with reproducibility and maybe help with, eventually someone will develop a tool, and that could be an NSERC grant, to Megan's point, or lead to a new data collection, which could be a SSHRC grant. So there could be some pay it forward mechanisms that you could make mandatory for people accessing and using CANUE that don't involve money or grants directly.
And then to add to that, by submitting could require some loose standardization, and then you could get some data governance going.
So, I mean, and the inexpensive or not on your budget part wholly is to partner with those Healthy Cities training initiatives. So they have to host annual meetings. They need to figure out what to present there, get in the space and like do the networking there. If you're trying to do city clusters, if you're trying to get people using CANUE data. So that's a way to, I think, foster that next generation and just make sure that it's probably on your plate, but you develop goodwill and partnership into that one.
One of the things I wanted to pick up on was, being the data hub, and that's something that often when we talk to potential partners inside the government, like StatsCan or NRCan, they think, well, we have all these functions of maintaining all the data, and so they have a harder time seeing the value of CANUE, which in some ways, Megan, you described very nicely is the bridge that we provide, which is, I'd say, is right on for that. But I don't know whether there's other arguments people might have around that and saying, look, this is something that needs to exist like the way it does, outside of, government and the data that they hold, so that we can come with strength. Like, for example, I'm going to meet with Health Canada next week about CANUE. Well, why does it need to be how it is?
It needs to be in one place, I think, right? I mean, we're doing a study linking forest fire data to CanCheck, right? So we had to go to NRCan and get all the forest fire location data. Then we have to go somewhere else to get air pollution data. We have to go to StatsCan for all the covariates for the, having those sort of useful things all in one location is super useful. And I think for a lot of us, we could just call Jeff and ask where we need to go. But if you're someone that isn't sort of already in the loop, right, it's very difficult to piece all these things together.
I think and highly inefficient. I mean, the processes to understand what government has available, data has available, and how to access it and clear that is a barrier to experienced researchers, let alone people walking in or cities that have a project they dreamed up in Red Deer, Alberta. I don't know, like they're not going to know how to get into that space. So you sit differently there. The other point, I think, earlier on, you've done a great initiative to link your environmental data into the cohorts that was on a slide earlier. And I think Lise Gauvin years ago was like, put it all in one place, the like environmental data and the equity metrics that we want people using and get them there so that it was easy for the student to decide to include those or the early researcher to decide to include those in their analysis. They didn't have to go to a different place. And so if we want to do that prioritization of environments and equity, keep building those into the data sets. And that's something that I don't think the government agencies have done without pushing forward. So I think that integration into a single data set facilitates the kinds of analyses that we need to see here in 2021.
And I'll just add training, right? It's not Health Canada's role to train Rae and everyone coming afterwards. It's that's something that has to uniquely happen with strong collaborations with universities and other institutes, and training has to remain a core part. We heard it many, many times today, and it's a huge value add. And so that's another reason why you want this to exist outside of a formal institution and in close collaboration with academic partners where students are enrolled.
Yeah, and I would add that, similar to what Laura said, I think there's actually advantages being outside of government, huge advantages. Also, we can take advantage of many cities actually have open data initiatives that we will never see at the national level. So there's problems with standardization, but there's also unique things that we can get at city levels. And perhaps, thinking about bridging, perhaps one thing that CANUE, this isn't a dream, could do is actually link cities together. Because when Vancouver's open data is not the same as Montreal's, and I know they do talk, but maybe we can actually help you know, at some stage in that harmonization, so that there could be another layer of sort of nationally comparable data that is actually not the federal government doing. I think if we wait for that, we'll be waiting forever. It serves a purpose. We can access it. We can think about, you know, making that available to our students and in parts of training, but there's other data that we should be actually thinking about.
So that's a good point, Mike. You know, we have seen many times there is data that's at that more local level, and sometimes that's where the richer data could lie. And there's always been this tension with CANUE, and well, we want to try to be standard across the country. You know, and I don't want to like be limiting that other data to be just standard nationally. I think I'm hearing from you that that's a valuable thing to do, and also unique for CANUE in the context of, you know, what maybe the federal government would do. What others think about us sort of maybe sort of loosening our criteria on the data wanting to be national, and start to think about these local efforts. I think I heard someone else talk about you know, work getting, I guess, Mike, you had mentioned around having city level working groups, which can dovetail nice with, you know, living labs and the ideas that Corey talks about living labs, and other talk about living labs. So probably around that model of city level working groups, but that are connected through, you know, something like CANUE, we could find a niche.
I wanted to hop in just to bring up something I'm seeing in the chat stream, and this is the idea of how right now we're restricted to proprietary postal codes, and we are making a big effort to try and move to more open source data. The issue being, of course, to connect it to individual health data, we're still stuck at that postal code level. And I appreciate we need to educate the REBs that getting a 6-digit postal code is actually important, and making sure, you know, even some of the clinical health researchers recognize that catching the geographic 6-digit postal code will, you know, vastly increase the opportunities to do more research with the data they do collect. We're definitely moving to holding more open source data in CANUE that's not connected to postal codes, so that may be useful in some ways, but we definitely recognize that as an opportunity to grow and to put it into these new tools that we talked about for healthydesign.city, which will be based all on open data.
I think,
yeah, you want to hop on that, Rae?
well, just the idea of like city level hubs for CANUE, I think would help with the public knowledge translation piece, because Canada is an enormous country. So, you know, each city is going to have practices and community efforts that are different. So researchers that are positioned in different cities are going to be able to connect with their community in different, more meaningful, locally appropriate ways. It'll provide the community with a touch point. So if there's community organizations that want to do research, so like Megan mentioned Red Deer, Alberta, you know, Red Deer will know City of Red Deer, who comes to GeoHealth Network events actually, they do. And, or like I have people sign on from government of the Yukon or from all kinds of places across Canada. They'll know to get in touch with the CANUE hub in Edmonton or in Calgary or wherever it is. And they'll have a local person that understands the issues they're facing and can link them to a local researcher. And that's how you can start to have more equity focused, appropriate research questions, and a researcher who's an expert in, you know, Alberta's environmental exposures, and I think that that's a great idea and can link in local students. And I think that would really help.
I think that's a neat idea. I mean, in the past, we focused the teams, like Mike said, on, you know, exposure topic specific, but maybe going forward, the teams are focused that each is a city team. You know, it's a group of people in each space that makes up a special team.
I think what I'd say as you do that is just a reminder of the importance of doing it outside of our big cities where they have capacity, may develop their own tools already. The CANUE walkability workshop that happened in Newfoundland was a fantastic place for us to all go and think about a very different context than we'd ever been in. And just to ground us in that environment instead of, you know, our usual gatherings in large cities. So I think that's a ripe and hungry area that you can make a difference. Again, can't do everything.
Yeah. I mean, I see some opportunities, and hopefully there'll be good news about the Think Cities initiative for some great synergy.
Jeff, I think Howard had his hand raised
Yeah, I'll
at
get
some
to
point.
it.
Oh, sorry,
Yeah,
because we're gonna wrap
You're
up
in a
in a
hurry.
few minutes.
I
So
know you're in a hurry. So I mean, there's been two talking about U.S. links and what are we partnering with the U.S. and certainly there are few U.S. people here. And so we're definitely open to that. We have had conversations in the past, you know, with people at the CDC, they're managing data sets, and the US EPA with data sets. Again, inside government more than outside. And we know clearly things like air pollution don't cross borders, and there are, you know, North America-wide air pollution data sets. But, you know, in so much as we could do more of this to, you know, begin to do North America-wide research, you know, that would be great. So, you know, for those who have thoughts, Howard, do you have some starting points we might want to pursue in that area?
Well, sure. But I mean, I guess I want to address directly the practical question is how do you keep funding going on for CANUE?
Yeah.
And I think the point about U.S. institutions is that, you know, for the most part, the Healthy Cities agenda, which, you know, I grew to really love and embrace while I was in Canada, I can see is blossoming in Europe and in Canada. It's lovely to see a Healthy Cities initiative at CIHR. It's really nowhere in the US, but we're getting there. And I think that the pandemic has sort of shifted a lot of the conversation to thinking about how we deal with the inequities within cities and how cities can deal with these multiple public health crises like COVID and climate change at the very same time. And I think, you know, that the foundations are going to get there. And the way to, I think, this funding opportunity, I see it, is providing some partnerships. And of course, I would love to promote my new institution here at USC, which many of you know has a pretty big portfolio of environmental health research. But these are the kinds of partnerships that can then be leveraged with US foundations to say, this is an innovative way we have to go. And, you know, a partner like CANUE, which has built this entire infrastructure, has all these connections, has all these ideas, is a lovely partner. And I think that's, you know, that's one way that I think might be worth pursuing.
Mm-hmm. Mm-hmm. Now, is there a context? So some others have talked about, you know, what we're learning from the pandemic. It's come, you know, through a number of talks, and, you know, is the pandemic creating the right climate for us to be, you know, sort of more aggressive in our message? Sometimes I wonder whether or not, you know, when's the right time to talk about this when people are down and out, right?
Oh, absolutely.
And, you know, is now the right message that we seize on it, or, you know, or do we have to wait another few months till, you know, this many % are vaccinated?
No, this is the time. I mean, I've been at conferences the last 2 months already on the lessons we're already learning from COVID.
Yeah.
I mean, the last one, you know, Rachel Walensky, the new CDC director, started off by saying, don't ask me to predict what's going to happen in the country or the world in the next 2 months. I have no idea. It depends on things and behaviors that are totally out of my control. But we have so many things we've already learned that we need to put into play. And she's right, you know, and a lot of us are pivoting to already thinking about how, you know, like I said, cities are going to deal with these crises going forwards. Now is the time, I think, to already start building these concepts, building some early collaborations, maybe on data to show that we can transplant some of the ideas to the US and benefit from this kind of thinking. So yeah, I think now is a very good time.
and let's go to John. I think John's had his hand up.
Oh, yeah.
Thank you. Just very briefly, first of all, I commend both CANUE, but all of the speakers today as well. It's really been great to hear your perspectives, including from the inspiring and faraway places. And it's sort of fitting comments with Howard as well, that Well, Howard and I are talking regularly about working together, bringing cohorts together, and we are actively doing this. And so I was delighted that others spoke about the CanPath and the other Canadian cohorts being linked to CANUE. We see this as hugely important and really a step in the next direction, or into the next phase. But just very briefly, two links that you've already referred to, but I just wanted to endorse and applaud further. Well, filling in the gaps is going to be important because, many of you would know that although CanPath is by far Canada's largest cohort, there are gaps in that, whether it's the gaps in the people included, the geographies covered, i.e. we don't have the far north yet, but every other province is covered. And then the harder things to measure, and that includes the experience that people have in the environment. So, Jeff and Howard and many others here worked hard on the exposome idea a few years ago and trying to pitch that to CFI. I think that continues to still be an opportunity. We know that our CanPath participants are very enthusiastic about measures that relate to where and how they live. So this is where the environmental measures made available through CANUE are fantastic, but we could actually measure more. And to Jeff's final point, it is interesting. I think COVID is a driver of the recognized need for Canadian data to be accessible, brought together, linked and linkable. And the fact that within the CanPath cohort, we were able to get over 100,000 people to rapidly reply to a COVID questionnaire about the impacts of COVID, and to allow us to continue to follow up with them, including doing seroprevalence testing right now. So yes, I think the timing is quite good for CANUE, building on everything that you've accomplished. There were some clever and wonderful ideas today, and I personally, but also with the supports of CanPath, I'm sure Philip Awadala, one of the co-PIs here, would also support that. So count us in and let us know how we can help, but I'm happy to help you get to the next level.
Yes, we're still wanting to work on that joint pitch deck because I think it can make a compelling story. Eleanor is putting up the next steps because we're down to 5 minutes left. So that's perfect. Are there any burning points anyone from the panel or our speakers previously would like to make? No, I think you've made them all. We could go on quite a bit more, but I think I'm really happy with the format that we've set here in terms of this AGM. And it's allowing us all to exchange ideas a lot more. So I think that's something we'll want to do going forward, to be involving more people. So very much appreciated for people partaking in this first one and the excellent speakers that we've had, and the number of ideas that have come forward, yes, are outstanding. We can't do everything, as was very clearly pointed out. So we continue to make sure we're excellent in our our data platform, and make more opportunities for people to exchange. I think, one of the most exciting things for the entire CANUE was in our first workshop, in our first break, when, you couldn't even hear yourself talk. The pent up excitement of people seeing each other and exchanging in this area was really noticeable. So we can maintain that, and we're finding that we can do this a lot more online these days. So that's a good thing. So that will, I think, help us have more presence. I think a big point that Mark made at the beginning of his talk, was around, well, there's a lot of evidence out there. We kind of know what's good. We kind of know what's bad. We're really stuck with some of the challenges on how to, integrate systems, since, some things will exacerbate a health issue and others will help it, but they could be contradictory. So it's, it's not an easy path to sort of hoe to give a plan or a direct answer, but we can get better at that for sure. There were in the past opportunities for us to even interact with the Federation of Canadian Municipalities and their Green Municipal Fund in wanting to spend money in cities in the area of climate adaptation, but with a thought of health. So, they've recontacted some of us in CANUE, and I think now the time is right to think about how we can use some of the tools like the Utopia tool that Mark talked about. But, the big thing was we know this, so it's how do we use our information for change? Thinking the same thing, right? More solution-oriented research, more, sparking change. And I was happy to see Howard and others say that, the awareness and John about the COVID questions, and the same thing happened in the childbirth cohort with respect to people being willing to answer things related to COVID. So there is, at the individual level, a lot of people thinking, wow, I'm seeing we need change. I'm actually enjoying some of the change I'm experiencing myself, given other downsides, of course, of the pandemic. But, that sets the stage from the grassroots level, right up, hopefully, to institutions, if we can show where CANUE plugs into that. So that's something I think we got to really refine that message. And clearly the other message that, the pandemic also exacerbated was around, equity and how we can be helping in, health equity impact assessments. And then, tracking forward, the benefits of interventions. And I've thought a lot about how fast it's possible for something like CANUE to update environmental data to show that the environments have changed in these areas as a result of interventions. Scott mentioned needing to know in advance. That's definitely true to be able to do that. But we do need the data to come in much more quickly to be able to start to connect the dots and show right away the benefits of decisions that have been made that have been described so far. So with that, I'll just wrap it up. I really appreciate everybody joining today, supporting CANUE. I think we've given you a good acronym to remember, so it's a pretty memorable one to share and pass around. And so let's keep doing that. We've got lots to think about from what everybody provided today. We'll share some of those thoughts as we pull them together. Come back to you for more help to create more partnerships, more networks, and I'm quite optimistic that we're going to find those resources to go to the next step. So certainly not thinking that we're going to go into hibernation mode at this stage. And clearly, it's not me, it's not Eleanor, it's not Danny, although we've been here through a lot of it, a lean, mean team, but enjoying bringing this together. And, it's all these faces you see on the screen and many, many more than we can even know, that we hope we can continue to connect with. So with that, I'll finish off and say thanks very much. Stay engaged, and we'll take all your great advice and hopefully spin it into gold. Thanks, Eleanor. Thanks, Danny, for all your help on CANUE so far, and we'll be in touch.